You are listening to the Body Charge podcast, and I'm your host, Sandy Sanderson. Welcome to the Body Charge podcast. Today's topic is your bite misalignment causing pain, sleep problems, or other health issues? Improper bite alignment doesn't just affect the jaw. It can seriously impact headaches, neck pain, TMJ, sleep disturbances, and even stress levels. When nerve messaging and electrical signaling become interrupted or impaired, it can have a domino effect on other parts of the body. My special guest today is Dr. Robert Kerstein, a prosthodontist with over 40 years of experience specializing in computerized bite analysis. He's passionate about helping patients and practitioners move past symptomatic treatments and towards lasting solutions using cutting-edge T-scan technology. So welcome aboard, Dr. Robert. How are you today?
Very good. Thank you for having me. I appreciate the opportunity to help your listeners understand some of the complexities of bite issues and common bite problems.
Yes. Well, I've been excited about this particular podcast because it's the first time I'm interviewing a dentist, and the mouth, the teeth, the bite is so important for the rest of the body. So can you please elucidate for our listeners how bite alignment can affect other parts of the body? What's that connection all about?
Well, it's actually a neurologic connection. And the teeth actually are not well understood neurologically. They actually do a number of amazing things for people that are beyond just chewing up food. The teeth neurologically talk to the center of your brain to command your brain as to how to swallow, chew food, and have the food go down into our stomachs rather than into our lungs where we would choke and die. And the swallowing mechanism is a survival skill that is hugely important. We swallow 1,000 times a day, and that doesn't include just eating. That's to lubricate your throat and to keep your mouth tissues moist. And so the swallow mechanism is actually directly controlled by the teeth, the back teeth pulps, which is the nerves in the teeth, and the periodontal ligaments, which are the socket nerves around the back teeth, and they talk directly to the brain. And so without this connection, we would not be able to swallow food and talk comfortably and eat a meal, and we'd be choking and we'd be having all kinds of trouble. Well, bite problems arise from that system backfiring on the patient because the back teeth can promote too much nerve stimulation from the teeth themselves by being pushed around as someone chews, eats, and swallows. It's actually a friction in the back teeth that promotes most of the excessive neural output, or let's say the amount of electricity that leaves the teeth when you're chewing and biting down and using your jaw. And that excess electrical activity affects the brain. And it actually has been shown recently to induce cortisol release, which is the stress hormone. And using T-scan can actually cut down the stress hormone dramatically, 50%. So the brain chemistry around swallowing is greatly impacted by the teeth, and the electrical activity they give off influences other parts of the body. Just to finish the question, because I know you asked about how can it affect other parts of the body, where the teeth enter the brain is a structure called the reticular formation. It's a large middle of the brain structure that encompasses centers for swallowing, obviously, breathing, circulation, respiration, posture, and sexual function and digestion. So
Wow.
all those, yes, that's where the teeth enter. And so when there's too much electrical activity coming in, it affects these other centers of the body. And so someone might have forward head posture that they don't realize they have forward head posture. Someone might have a higher shoulder than one other shoulder. Yeah, exactly. Someone might have facial pain and headaches and TMJ from these muscles being
Or
extra
or even
excited.
neck pain sometimes. I have
Yes.
a friend who has chronic neck pain. You just made me think of her. Maybe I should ask her to see a dentist.
Well, the neck receives supplemental input again because it's involved in swallowing. The pharyngeal muscles, which are the muscles of the airway and throat and the lower airway surround the throat and the airway, and they compress the airway, and so you can have sleep disturbances because you grind your teeth, and then your muscles around your throat tighten up and squeeze your airway and shrink the airway. And we've been able to reverse that with T-scan treatment to the teeth in very specific ways that relaxes all the muscles involved in this process of swallowing, and and the airways open. So there's many implications because the teeth talk to this reticular formation directly, and it really throws off a lot of electrical activity that the body doesn't really need, and then it influences structures that are leaving the reticular formation.
So a kind of overstimulation, which causes excessive stress. So I know a bit about stress
Yes.
because of my work with magnesium,
Uh-huh.
Elektra magnesium. So we formulate a lot of products that you can use on the skin, creams, lotions, sprays for transdermal absorption because we have a big problem today with recovering from stress and we don't get enough nutrition from the food that we eat. And so any stress on the body over a long period of time will eventually lead to degenerative disease or premature aging. And that's why magnesium researchers over time have called magnesium the anti-aging mineral because it's
Wow.
just fundamental to our electrical energy resources. And that feeds into the whole nervous system. So it's
Yes.
amazing how everything is connected with the teeth, which has got such a high level of innovation by the sounds of it. It's like a master controller center and that it feeds the digestive system. So I would assume the when we're chewing, then the release of digestive enzymes and production of stomach acid. So the whole vagus nerve system, which runs down the alimentary canal, and that then triggers peristalsis and gut health,
Mhm.
like the whole canal from the teeth down to the other end would be affected, wouldn't it?
Well, once the food moves into the digestive tract, I would say that most likely the tooth influence is secondary to that, but getting the food into that digestive tract is a crucial survival skill that the teeth manage for all of us. This is why you eat, chew, and swallow, and nobody really thinks about it. But the teeth are actually modulating the entire thing. And they also talk to four cranial nerves to assist in doing that. And one of the nerves is the pharyngeal nerves, control the pharyngeal muscles. Another is the facial nerve. Another is the oculomotor nerve. So there's all kinds of sort of head and neck and throat direct influences that the teeth have. And once the swallowing is done and the saliva has entered the stomach with the food, that stimulates gastric acid release and digestion takes place. And so I would say most likely the teeth are influencing the front of that process. But there's no question that there's a direct line between the teeth and the
Yeah, like
process of digesting food.
a domino effect. And
Yes.
the other thing I believe also is that the teeth, the chewing mechanism when you're using the muscles influences the structure of the jaw as well. So if you're not using your muscles to chew sufficiently, the jaw starts to shrink. Is that right?
Well, the muscles can atrophy. It's a very good question.
Atrophy,
The
yeah.
muscles can atrophy from the teeth overworking them unknowing to the patient. So then they become less functional. So the electrical activity hyperfunctions, we use the term hyperfunction, it means contracts too many muscle fibers while the chewing process is going on and the swallowing process is going on. And that leads to a lack of oxygen in the muscle. Just like very much like if you were to weight train and you move your arm and your arm starts to hurt. Well, the teeth fire all these muscles too much for people that have jaw problems. And then the muscles become ischemic, we call, which means that they lose oxygen and that makes them fail in
And
functionality.
and blood flow.
Yes, blood
So we
flow is
need
released,
healthy
is
healthy
reduced.
blood flow for our immune system as well. So the teeth, the roots are connected to the circulatory system and the immune system.
Yes, yes,
So then you have
yes.
an
And
on
through the reticular formation, through this entrance into the brain. And this is where they cross communicate with other systems that you're talking about. And this is where they create their influence. But the direct influence is really the muscle physiology of swallowing and pushing food safely into your throat rather than into your lungs. And that system backfires, as I said, when people have bite problems. That's what actually causes TMJ.
So TMJ leads to headaches, problem sleeping, so chronic stress.
Yes.
Yeah, they're
Yes. Clenching and grinding the teeth,
grinding. Yeah.
facial pain, chewing fatigue, weak chewing.
Yeah, I
Yes.
think many years ago I must have had some TMJ, which was never diagnosed because it's a relatively new thing in dentistry. I'm talking about many decades.
Uh-huh.
And, stress can do that. Gut disorders can do that. There's lots of things that can cause teeth grinding at night, and you wear away the enamel. And then
Can do that. Yes.
you can, yeah. So, it's important to get some help if you're finding you're having those symptoms to protect your teeth. Maybe wear a mouth guard, and there are other strategies that can be employed to help prevent that. But the bite analysis, when it's analyzed to be overstimulating, so you're getting too much friction or irritation, is that right? What about when there's not
Yes.
enough and the teeth aren't meeting?
Well, that's a good question. Also, then you have weak function because of a lack of surface engagement of the teeth that makes it harder for the person to use their teeth. But the reverse, too much friction is actually the main player. And you mentioned something that I feel I should comment on. You talked about using a night guard to help prevent bruxing. Night guards don't prevent any bruxing. They get in the way of the teeth. Studies that we've done now for many years show we can stop people from bruxing and clenching without a night guard by treating them with the T-scan, high precision data, bite analysis, and bite adjusting. And the person doesn't have to wear anything. They actually stop clenching and grinding. And this is not new. This has been documented in the literature for many years. The common thought is that a night guard protects the teeth. But it doesn't really work because when patients use their own teeth without the night guard to chew, eat, and swallow, the same friction that causes bruxing and clenching causes high muscle firing and still wears their teeth down or still weakens the enamel or weakens the roots around the neck of the teeth where you get gum recession from bite-related issues. So T-scan technology is a much better way to address all of these issues because it controls the neurophysiology. That's how precise it is. Whereas a night guard is just a barrier to the teeth and it doesn't
Yeah,
really
just
work.
a
It doesn't
mechanical
really,
thing. Yeah,
yes, a mechanical barrier, which helps the people to have a barrier. But when they don't wear that, their symptoms
yeah.
return, their bite
Mm.
continues to damage their teeth,
And
and
they
so they
just
continue to,
clench. Yeah,
and they
clench
clench. Yes.
because it's an expression of stress. So how does the T scan actually work? What do you do?
Well, the T-scan, let's see if we can. This is the T-scan handle and a sensor. Person bites on the sensor and data is recorded with these high-tech sensors that are used all over the world to machine parts that frictionally engage. So things like tire tread against the road, things like engine gasket seals, things like brake pads in your car. Those are just a few examples. The sensors are used in aerospace, robotics, automobiles. The defense industry uses them. They're incredibly diverse, and there are medical applications, of which one is the T-scan. But the same electronic components that someone would bite on, you can drive on, you can sit on, you can walk on. And so you get
It
real
measures
pressure
pressure.
mapping.
Yeah,
Yes,
measures
you get
pressure. So it's much better than the piece of film and looking for the indents in the film when you're biting
well, the paper, you're talking about the
the
articulating
paper.
paper.
Yeah, yeah, yeah.
Yes. Yes, the paper is advocated to be able to show dentists force, pressure, and timing, but it actually can't do it at all. And dentistry is resistant to recognizing that because dentists just look at the ink and try to choose by size, and there's no correlation. And you can't control the neurophysiology without very high tolerance, high precision, minuscule corrections to the friction on the teeth that can only be done by measuring it and then machining it out of the bite with high precision as I said, minimally invasive, but highly accurate, much more accurate than can be done with the paper. And that's why the paper method has never worked. It's too inaccurate. But T-scan sensors are incredibly accurate. They record down to 3 thousandths of a second, and they give you a dynamic video of the bite that shows where pressure grows, where pressure starts out low and then becomes maybe too forceful. Other places it grows into a reasonably low level pressure area. And the timing feature is incredible diagnostic tool.
That's
So it's much
amazing,
more, yes,
amazing
it's much
software.
more. Yes, that's the thing about it. It's a major upgrade for managing bite issues for dental patients, whether it's TMJ or installing dentistry, like making crowns and having the dentist again look at the ink and try to figure out the bite forces when the T-scan will measure all the bite forces on the new crowns and show you which ones you should adjust and which ones you should leave alone because they're good ones and they won't break the new crowns. So there's a lot of applications all through dentistry for the T-scan.
Wow, it kind of reminds me of the Winter Olympics at the moment where someone can win by a 100th of a second. And I'm thinking just a few decades ago, they would have to rely on the eye measuring from a long distance.
Mm.
And we had
Yes.
nowhere near the precision. So sometimes there was a tie, but if you measured down far enough with the electronic technology we have today, you could create that difference of 100th of a second. So it would be a similar level of precision, wouldn't it, with the bite scan technology, by the sounds of it?
Well, it's a great analogy because when I lecture, I often use that analogy of they have the swimmers coming under the water to the wall, and they reach out to touch the wall, and the clock is thousandths of a second, which is exactly
Yeah.
what you're talking about, and they can predict the winner from that accurately. T-scan thousandths of a second predictably finds all the bite problems, and it's a dynamic, highly accurate method, so much more accurate than using the paper and the ink and the dentist thinking they can read the ink when the truth is, and this is important for the listeners to understand, the paper and ink doesn't measure anything about the bite except the size of the contacts. And the size of the contacts is not a method that you can use to improve the neurophysiology and control the bite outcomes. It doesn't translate into force, pressure, and timing. It's just a surface area measurement, right?
Yep.
It's not a dynamic force pressure mapping method,
Yeah.
and it's really a problem for dentistry because dentists don't choose the marks well. Studies we've published show dentists choose the wrong marks very, very often. So they
Yeah.
grind the wrong places. That's what it really means.
Well, and you might have something done you don't need because someone has made a judgment or an estimate or an assumption that's inaccurate. Yeah,
Yes,
so
yes.
accuracy can make a big difference even at a very small scale when it comes to your teeth. And how important is that? I mean, the repercussions potentially, if you don't have a good bite, you can't chew your food properly, the nerves
Yes.
don't get the right messages, things don't happen the way they should downstream. And
Yes.
and then there's this chronic stress and you don't know where it's coming from. It's in the background. So it must be like triggering the sympathetic nervous system all the time. The body feels like something is wrong, it's not right. So
Mhm.
it's in a state of unease all the time.
Well, that's actually a very good point you're making because the stress induced aspect from the bite is this electrical activity that's too much, and the brain perceives it as a threat and then releases cortisol, which is the stress hormone. And what we've been able to do with the T-scan technology is adjust the bite, control the electrical output. The brain perceives far less electrical activity and it lessens its stress response. And then the cortisol release is dramatically reduced. And this was recently discovered in a bite adjustment study with the T-scan. It's about to be published in the Journal of Prosthetic Dentistry. So treating the bite reduces stress that it isn't the stress that causes people to necessarily clench and grind their teeth. Their teeth emit stress into the brain, which then stresses the body from the stress response. The cortisol is released when your brain thinks it's under stress. And so the bite is actually a major stress additive element to someone's constitution. And this is where the T-scan really helps to control many aspects of it.
Yeah, that can be like a negative feedback loop because the more you feel that background stress with a misalignment of the teeth, um, the more stress you have, the more you lose magnesium, and the lower the magnesium, the more stress you feel, and that's a vicious cycle, often called the vicious magnesium cycle of deficiency. And you know, most of the time people are completely unaware of what's causing the stress. They're trying to blame other things, but not drilling down to the actual issue, um, which is can be the teeth, often the teeth, right? That's a major component in the body. It determines so much, as you said, very close to the brain. It
Yes.
influences all the nerve connections in the whole circulatory system of the body, the digestive system, how you sleep. So, yeah, tell us more
Yes.
about how it affects sleep patterns when you properly adjust the bite. How can that affect or improve sleep?
Well, it's a very good question also. So the same muscles that affect chewing, eating, and swallowing also impact the airway. And a lot of people don't sleep well because their airway is constricted. And it can be constricted from a big tongue. It can be constricted from, throat anatomy. But a big constrictor is actually just swallowing. And over time, people's throats get tighter and tighter. Now, they don't necessarily feel that it's getting tighter and tighter. And it's sort of like your bite. You don't necessarily feel that it has too much friction in it. You just use it. You just go about your business, and it's
It
throwing
becomes
off all this
normal. Yeah.
becomes normal. And when people have bite problems, they're aware of it. It's usually because a filling feels high or a crown was just made and their bite changes. But most of us go along with our bite operating as it is without recognizing whether it's good or bad. And that's not a function of how it's aligned. It can align beautifully, and the person can have TMJ even though it aligns beautifully because there's too much friction. So the impact of the friction to tighten all these muscles over time also constricts the airway. And so the T-scan, by again using high precision bite adjustment, micro adjusting of the friction, specifically the friction is the main player in all of this, because the friction tightens up the muscles by firing too much electrical activity. By using the T-scan, we open the airway without wearing a snore guard or a mouth guard, and the person stops clenching and grinding while they sleep.
Wait a minute.
Both
Wait a minute.
things.
Are you saying you can stop people snoring?
Well, I don't know about snoring per se. I'm talking about airway volume and
Mm.
airway area.
Yeah.
That's what we've discovered, that the airway, let's say your airway was 100 millimeters of square area, and you have some mild sleep apnea. After T-scan bite adjusting in a specific way, which is applicable to these kinds of problems, the airway opens to 150 square millimeters, 175 square millimeters. It doesn't open 10 square millimeters. It opens a third to a half more by lessening the strain to the muscles around the airway. And the person doesn't know their airway is being tightened by their swallowing mechanism. So we've seen this multiple times now, and a common response from a person isn't they come back and say, "Wow, my airway's open, 50% bigger than it was." They come back and say, I slept so much better, and my husband didn't hear me grinding my teeth. A typical response would be, my husband used to make me leave the room because I was grinding my teeth. And ever since you adjusted my bite, not only am I sleeping longer, and that's because there's more air, right? Naturally, the airway is opened by the relaxation of the throat muscles and the pharyngeal muscles. But the person also stops clenching and grinding and doesn't have to wear a night guard. That's the beauty of T-scan guided high precision micro adjusting, is that it changes the physiology. The person doesn't have to wear a fake barrier like an appliance. They don't have to wear a snore guard that trying to get more air. And what's interesting about that is if they do wear one and they sleep better because they're wearing a snore guard or a mouth guard, when they take it out in the morning, the airway goes back to the same shape and constricted pattern that it exists in. It doesn't become bigger by 50% or 70%.
Yeah.
That only happens if you relax the system through the central nervous system. And that's what the T-scan high precision micro adjusting is all about.
Yeah, so you've got to really address the actual anatomy rather than having props like the mouth guard is a prop, is a mechanical
Yes.
prop, but it's not
Yes.
fixing the problem.
No, no, and neither is, for example, like Botox. We watch TV. I don't know about in Australia, but in the United States, there's these wonderful Botox commercials. The women, they start out with their head down and they're, rubbing their head, and then the next scene, they're out in the pasture having a picnic with their kid and their husband, and in the background, the narrator is talking about how wonderful Botox is. Botox is a poison that you inject four
Yep.
times a year
But
into your head. It's like
botulism
yes.
toxin. Hmm.
Its name has that word in it, toxin, right? But the solution isn't a cure. It paralyzes the muscles that are bothering the person for a few
Mm.
months. The toxin has to be metabolized. So it stops functionality. It paralyzes the muscle.
Mm.
And then people have to go back and get it again and again and again, right? And when you treat the headaches, if they're in this part of the head, which is the temporal region, that's the tooth-related headache region. If you treat again with T-scan high precision micro adjusting, the person doesn't get the headaches with anywhere near this frequency. They don't need the Botox. And if they get a headache, they can take an aspirin or a Tylenol like a normal person and, manage it normally. And this is a huge
Or
improvement. All
drink
of
more
this,
water with
drink
magnesium.
more water. Yes, well, for sure. But unless the person's bite is managed,
Mm.
all the systematic approaches that are like, take a supplement, use a medication, apply heat, drink more water, which has more magnesium in it, they'll only have a limited impact because the neurologic output of the teeth overpowers them all.
Yeah.
And that's why people suffer for years with chronic facial pain or chronic headaches that steadily get worse. They don't, stay the same. If you ask someone who's, let's say, a chronic headache patient, how were your headaches 5 years ago? They would say, oh, they were a lot less, and now, oh, I have a headache every day. 5 years ago, I took an Advil once or twice a week. Now I can't go anywhere without my Advil, my ibuprofen.
Wow.
I'm getting Botox. I'm grinding my teeth, right? So the problems, because the bite is used thousands of times a day to swallow, the problems continually escalate. And it's not escalated today versus tomorrow. It's over time. People see it getting worse and worse and worse. And the T-scan micro adjusting, high precision adjusting stops it all. It knocks it down. So there's only a small amount of electrical output coming from the teeth. And then the system all internally changes, because the electricity is way down.
Well, you remove the stress load and then the body can go back to its normal position, right? So it makes
Yes.
perfect sense. So where
Yes.
can people find you if they want to learn more about how this works? Can you give them your website or contact?
Yes. Well, my website, www.drrobertkerstein.com, there's a lot of information there, but it's mostly for dentists. For patients, there's a very good website. I'm also part of, it's an educational website for dentists and patients. It's called www. I should know it. Yes, www.digitalocclusionseminars, all one word, digitalocclusionseminars.com. And it has information for patients, it has information for dentists, and that's where they would be able to read more about this high precision T-scan micro adjusting. And they also would be able to find providers. It's very important that the listeners understand that T-scan doesn't work because someone owns one. Many people own one. I know I've been to Australia a number of times to speak, and I've helped people learn T-scan there. But owning one doesn't make somebody a user. They have to have chairside training and with patients to learn how to use it, how to record from the bite the right things, how to analyze the data it gives you, the dynamic timing data, how to isolate the friction. They have to learn how to do that. And then they have to learn how to use its information to adjust. So only really trained experts in T-scan can help a patient with things like opening their airway or
Yeah.
stopping them from clenching and grinding. So listeners would be able to find those trained experts at www.digitalocclusionseminars.com.
Oh, that,
I think there's a providers tab on
yeah.
that website.
Yeah, that would be helpful if people want to investigate further or even approach their own dentist and ask them, for if they could maybe get it in or do the training. It's an extra instrument, an extra piece of technology which can really, by the sounds of it, enhance dentistry a lot and people's overall health, because some of these issues which come from the bite not being correct can influence other parts of the body where people are going to their doctor asking for help to resolve
Yes.
an issue, but the doctor doesn't
Yes.
have the training or the awareness to investigate, well, could it the problem be coming from the teeth? Rather than
Very
just
true.
prescribing drugs to mask issues and symptoms, that would help the whole medical system really drill down further into the root
Yes.
cause of the problem.
Yes. Well, the teeth are not well understood, as I said earlier, by the medical profession or the dental profession in terms of their neurologic causation of many things. An example of like a medical condition that would be bite related, let's say beyond headaches, would be unilateral hearing loss. People who have progressive slow hearing loss in one ear are often having bite overload on that side, and they're not aware of that as because bite overload, you don't feel it unless it's really like a single tooth that was just filled, the bite is thrown off.
Yeah.
Typically, the person just uses their bite and they get used to it and they don't know. This last week in Pennsylvania, I was training a dentist and there was one tooth that was taking 60% of the person's bite and they had no awareness of that. But the tooth was all worn away. It had lost all its
Mm.
enamel from this excessive pressure. And that same type of thing can cause the eardrum to not work properly. The electrical output of swallowing, as you may realize, many of the listeners may realize, like when you want to unclog your ears, you swallow, right? Well, the
Yep.
swallowing mechanism impacts the ear. So a lot of people lose hearing in one ear because their bite has stopped their eardrum from working properly. Not
Uh,
the eardrum hearing element. There's an element, there's a membrane that
the
covers the eardrum. It's called the
tu
tympanic membrane.
yeah,
And
it's a
that can
tubular
fail.
thing can get blocked. Yeah.
It
The
gets blocked because the tympanic membrane
mm,
doesn't retract, because it's spasmed out, because the bite has
mm,
overused it.
yes.
And so this is the kind of medical condition that someone would be going to an audiologist or to an ear, nose, and throat person. I can't hear, I can't hear. And they're looking in their ear and everything looks normal, with the scopes
Yep.
and the scans, because this electrical problem can't be seen. It can only be
It's
detected by
systemic.
dental technology.
Yep.
You can pick it up with electromyography.
Hmm.
Surface electromyography, you can pick up this electrical activity and you can monitor it that way and know that it's too much. But it's not something that if you look through the scope of an ear for an ear examination, they're going to see, high muscle firing and electrical activity, emanating from the eardrum, and
No.
they'll see nothing.
Yep.
So this is the insidious nature of bite problems. They
Mm.
they cause all this electrical disturbances that can influence this systemically, which is what you've been talking about. And it goes undetected because dentists and doctors aren't thinking, wow, that could be coming from the bite.
Yeah,
So,
we need
yes,
more
awareness is
education.
really,
We need more education as to what this technology can actually do because it's so precise. And yeah, it sounds like a big revolution in dentistry, really, and health overall. If we can become so precise, we can really pinpoint something and not guess so much as it might be this, it might be that, trying out lots of things that don't work, or maybe cause even some damage. So it just helps to add another level of precision to health diagnosis, doesn't it?
yes. Well, if one can isolate the friction in the T-scan information and isolate the high electrical activity in muscles that are affected by swallowing, which can be done with surface electromyography, the two together mark the diagnosis. So yes, your bite is sending off too much electrical activity. We can see that in your muscles. Your
Mm.
bite has these elements in it that are frictional. You
Yep.
can see that in the T-scan. Yes, that's why your bite is causing you to have pain in your face or frequent headaches above your eye or your throat feels tight. And these are very treatable anomalies when the high precision micro adjusting is done, guided by computers, as opposed to dentists looking at ink and paper and thinking they know what they're doing with the bite. It's not even comparable. Right?
No, it's
It's
very crude when you put it that way.
yes. It is a very crude process, and it's the worst part of it all for the patient, which they don't realize, is it's subjective, meaning a dentist can mark your teeth with the paper and tap, 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 and grind on the paper, and then they look at the paper and they think they know what they're seeing when number one, they don't know what they're seeing because the ink and paper doesn't measure anything about the forces and the timing of the pressure. And they choose with their own bias. And the reason I'm telling you this is if I have a group of dentists in a room and put up a picture of teeth with paper marks on it and ask them who thinks the first contact is the most forceful and who thinks the second one is the most forceful and who thinks the third one, let's say there are 8 or 7. The group of dentists, they all disagree. They don't know which one it is, and they all don't agree, which means the patient could go to my office, and if I guessed at the ink, I'd treat them differently than if they went to your
Yeah,
office
so
and
it's
you guessed at the
too
ink.
subjective, isn't it? Too
We're
subjective, too dependent
incredibly,
on a point of view rather than what really is the
yes. And
reality.
it's a very inaccurate point of view. Studies that I've published and others have published show that dentists choose the wrong ink mark, paper mark to adjust 90% of the time.
No way. Wow.
Yes,
That
90% of the
that's
time.
incredible.
Yes, there are 4 or 5 studies that show that. I think the best any group of dentists did, 250 dentists was in one of these studies. They did 87.5% incorrect. So they're a
Wow.
little better than 90% incorrect, 87.5% incorrect. It's not like they're getting 75% right and 25% wrong. They're getting only 10% correct and 90% wrong. And this has been studied 4 to 5 times with separate dental groups, about 1,000 dentists total. And what's interesting about that 90% error, paper marks only show force correlation 14% of the time. So what that means is a dentist would look at a big mark and choose it as big force 14% of the time. It would be big force. A little mark 14% of the time would be little force. The other 86% of the time, there's no correlation. So that means if you take 86% no correlation and dentists are subjectively choosing by size, they're going to be wrong 86 to 90% of the time.
Yeah,
And that's
wow.
what the research really bears out, right?
Well,
So
I
yes,
I wish you all the best in your education of dentists because this sounds like it needs to go much further afield. We we need much more of this kind of technology. I think that would be a great thing. So all the best. We're coming to an end of the
thank you.
podcast, and I'd like to thank you very much for this wonderful conversation. I think it'll be very helpful and insightful for people. I hope you like this conversation and will share it with others. Let me know what you thought about it in the comments below. If you want to listen to other Body Charge conversations, click like, subscribe, the bell icon, and click all notifications. Subscribe to our newsletter to get updates on blogs, podcasts, videos, and magnesium special offers at electromagnesium.com.au. Relax, recharge, and recover.